pretty well. So you can try that one out. At the same time, another one, posterior thoracics. I want to give you something else that people always come in and they're like, man, my upper back has problems. So these posterior thoracic points, essentially think upper back muscle pain. They're usually on the sides of the spinous processes. So you palpate right and left side. And these ones can actually refer to the elbow, specifically posterior thoracic point 4, which you just count down. It's basically thoracic T4. Same concept as before on ATs. You're just walking down the spine. On the anterior thoracic, you're walking down the manubrium. On the back side, you've got the spinous processes, the exact same / opposite side. So you just walk down 1, 2, 3, 4, palpating and pushing on either side. So posterior thoracic treatment, the patient is prone. Their head's off the table and on. Doesn't really matter too much. What I find is that I have to actually extend their head depending on the point. So for posterior thoracic 1 and 2, you keep the arms by the side. And you're going to have to extend the head because those posterior thoracic points don't really extend from the upper back. They extend more along with the cervical spine. So they keep their hands by the side, and I'm going to cradle their hand in a cup, in the cup position, and extend their head, and that's how that posterior thoracic, right? It's a extensor because it's on the back, so I'm basically extending it. It's pretty simple. Now, some things that I need to side bend away from the point and rotate away slightly. Now for lower points like 3, 4, and 5, they have this little round that goes 3, 4, 5, take a dive. And instead of arms by the side, they'll actually drop their arms off the table in front of them. Now for 6, 7, 8, 9, those are lower down on the T-spine, right? So what I have to do is put a pillow underneath the segments to get a little more extension. So I just slide a little pillow underneath them, or a sandbag, or whatever I have, and it extends them a little bit, and I still support the head. So you see this is maybe like a posterior thoracic 3. And you see the side bend and rotate away with that head. And one thing you'll see is arms are off like they're taking a dive. See how I just cup that head? It's nice and easy and relaxed for that person. Key is extension. So if I was hitting something lower, like a 6, 7, 8, 9, what I would do is I would just put a sandbag right underneath kind of where my pinky finger is. That would extend him even more. The next point, and I'd change the color for you so you could see this picture, is a TLES, which stands for thoracolumbar erector spinae. You know what that is, right? Basically, it's just longissimus thoracis, which I don't expect you to know, especially maybe if you haven't done an active release therapy spine course. But it's right there. You see that you have spinalis, you have longissimus, and you have iliacostalis moving more lateral on the spine, and those are your erector spinae groups. Right, so longissimus thoracis is one of the longest in the body, and it's also one of that big meaty ones that you see all the time that people use as this big bracing mechanism. So this is a great one that I find for so many people. So you're going to stand on the opposite side of that tender point, and if you're confused where the tender point is, it's pretty simple. It's anywhere along the belly of that muscle. So the spinous process move maybe 2 fingers, 3 fingers out. You should see like if someone on their upper back has just a big group of muscles running vertically down their back, that's the longissimus there. So you stand on the opposite side, you're going to monitor the tender point from the opposite side. And what you do is you find whatever level that tender point is, you just pull them up. You're basically extending them. It's super simple. Now they immediately need a pillow to slide under if they need more extension. I usually don't. I mean, I'm on the other side, I'm grabbing on them, and I'm just leaning backwards. Keep in mind this works further down the chain too. So like for example, if it's spinalis or an erector on their back, all I do is I just grab the hip and I pull it. So now that you know how to do this one, right, I just gave you posterior thoracics, which got a little bit of that neck movement and then down that upper back. Well, now you have the TLES that also works straight down the body too. You pretty much got the entire low back, and you even kind of got the hip. So you know if someone's got some pain on their back, like really close to them. Now it doesn't work for QL because QL is a different muscle. It requires a different shortening position. But you got spinalis, you got that entire upper back. Now all you do is you reach around and you grab the hip and you pull backwards, and it looks like this.